your attendance about this, for us all to talk about this important topic. I also want to make sure that we thank the Public Leadership Institute for enabling the technology for us to do the webinar today, so I appreciate that. So we're going to get started. We are here to talk about the Workplace Accommodations for Nursing Mothers Act, as well as the challenges that women in Pennsylvania currently face while trying to express and pump milk in the workplace. So we're going to talk about a few different things today. We're going to discuss the health benefits of breastfeeding and challenges new mothers face while trying to maintain a milk supply after returning to work. We're going to talk about the current rights of employees who express milk in the workplace. There's currently a patchwork of protections, as we refer to it in Pennsylvania, and the need for better legal protections across Pennsylvania. We'll talk about how this issue fits into the broader Pennsylvania campaign for women's health, and how you as advocates and citizens can support this campaign to improve the health and economic status of women in Pennsylvania. And our hosts today are going to go ahead and introduce themselves and tell you a little bit about their perspective and their respective organizations.
Thanks, Tara. Good afternoon, everybody. My name's Amal Bass, and I'm a staff attorney at the Women's Law Project. The Women's Law Project is a nonprofit legal advocacy organization based in Pennsylvania with offices in Philadelphia and in Pittsburgh. And we seek to advance the status of women and girls through impact litigation, public policy advocacy, and community education. We've been advocating for breastfeeding moms for a long time, and as a result, we hear from women across the Commonwealth who have faced challenges in the workplace when they need to express milk. And those challenges include being forced to pump in the bathroom or in a janitor's closet, to being told they can't pump at all. And today with this webinar, I'm looking forward to discussing the rights women have in Pennsylvania and also what we can do to make it better.
Hey, Rosemary, are you there?
Yes, I am. Good afternoon. Great. And my name is Rosemary Holt, and I'm the Director of Health Policy and Practice at Maternity Care Coalition. Maternity Care Coalition has assisted more than 100,000 families throughout southeastern Pennsylvania, focusing particularly on neighborhoods with high rates of poverty, infant mortality, health disparities, and changing immigration patterns. We know a family's needs change as they go through pregnancy and their child's first years, and we offer a range of services and programs for every step along the way. Empowering women to initiate and continue to breastfeed has always been a key part of Maternity Care Coalition home-based services. And I will pass this on to Katja.
Good afternoon, everyone. My name is Katja Pigur, and I'm the Director of Breastfeeding Services at the Maternity Care Coalition, and thank you for having me today.
Hello, my name is Colleen Krajewski. I'm a gynecologist in Pittsburgh, and I'm a member of Physicians for Reproductive Health. I'm here today on behalf of my patients who would really appreciate any support we can give them for breastfeeding in the workplace.
Okay, great. Thank you all for being here today. And I just realized as I asked you to introduce yourselves, I didn't introduce myself in the beginning as we were dealing with the technology. So for those of you who don't know, my name is Tara Murtha, and I am here at the Women's Law Project handling communications. So we're going to move on and get started. Breastfeeding has many health benefits for mothers and children, but many women, as we just mentioned, face difficulties maintaining their milk supply because many workplaces don't accommodate their need to express breast milk. The Affordable Care Act provides some protections for nursing mothers, but many women are left out of loopholes and are not covered. The Workplace Accommodations for Nursing Mothers Act fills some of those gaps in the ACA and would provide better protection for mothers in Pennsylvania and provide the accommodations that they need. So to talk a little bit about the medical and public health needs for improving expressing breast milk in the workplace, we're going to hand it over to Dr. Krajewski. Thank you.
Hey there, this is Colleen Krajewski again. Listen, I'm also a professor at our medical school, so I could sit here and talk for an hour, 2 hours about the breastfeeding benefits for moms and babies. We know that breastfed babies have a better immune system, a better digestive system, a lower risk for SIDS, and a whole host of lifetime benefits, which is why it's promoted so much by gynecologists and pediatricians. For mothers, it is a huge supporter for weight loss after pregnancy, and can reduce a woman's risk of cancer. What I hear from my patients all the time is that they wish they could continue breastfeeding for the full year that's recommended by the American Association of Pediatrics, but they cannot because of their job. Working moms need to pump often. Well, maybe often is not the right word. Working mom needs to pump at regular intervals throughout the day. People always want to ask me like exactly how many times, exactly how many hours. For most women, it's between 2 to 4 times a day. Pumping can take anywhere from 10 minutes to half an hour. As a physician, a lot of workplaces want me to write a prescription that, Miss Smith can take a break this many hours for this many minutes, and that's not really possible. But we do need to provide adequate support for what a woman needs. It is not hard, all right? It is not hard to provide these accommodations, again, for, a 15-minute break 3 to 4 times a day. Most women that I see initiate breastfeeding right after birth, but very few of my women are breastfeeding at 6 months because their workplaces cannot accommodate them.
Okay, thank you. And then Amal Bass is going to take us across the legal landscape of why this is the way it is right now in Pennsylvania.
Thanks, Tara. So now we're turning to what laws currently exist that protect women in Pennsylvania who want to express breast milk in the workplace. The main law in this area is the Affordable Care Act, known as the ACA, which passed in 2010. So this law has been around for 6 years, but based on the calls we get at the Women's Law Project, there are many people who don't know that this law provides protections for nursing mothers in the workplace. What the Affordable Care Act did was add protections for nursing mothers to an existing federal labor law known as the Fair Labor Standards Act. And what it guarantees is that nursing moms have a place at work where they can pump breast milk, a place that is clean and private, and a place that is not a bathroom. It also guarantees that nursing employees get the unpaid break time they need to pump. So break time and private space. That's what an employer has to provide unless the employer has fewer than 50 employees and can demonstrate that providing these accommodations would impose an undue hardship on them by causing the employer significant difficulty or expense. This law has been incredibly important for women in Pennsylvania. Before it passed, if an employer refused to let a woman express milk at work, there really wasn't that much available to her to protect her in Pennsylvania. Now, thanks to the ACA, in many of the cases that we hear about at the Women's Law Project that we're able to assist in, the issues at work tend to resolve once the employer is educated about the requirements of the law. And if those issues don't resolve, then the employee can file a complaint with the Department of Labor and Industry. So while the Affordable Care Act has been a very important law and has done a lot for women in Pennsylvania and across the country, it doesn't protect everyone. It does leave out some women, and actually quite a few women. It leaves out working moms who need to express milk beyond 1 year. And it also leaves out people who are exempt from the Fair Labor Standards Act's overtime provision. So these workers include people who work in executive, administrative, or professional capacities, certain employees at smaller newspapers, computer analysts, outside sales employees, and it also might, there might be a lot of other people who are exempt, and it's sort of based on this analysis about how much somebody's paid, how they're paid, and the type of work they do. So that generally speaking, salaried employees who perform relatively high-level work are not protected by the Affordable Care Act. So what we need to do is, fill in those gaps, and women, because women who are not protected by the ACA but work in Pennsylvania don't have the right to express milk in the workplace unless they work in Philadelphia, where the local law, known as the Philadelphia Fair Practices Ordinance, protects them. So basically, the law requires employers in Philadelphia to reasonably accommodate an employee's need to express breast milk, as long as doing so does not impose an undue hardship on the employer. It's great that Philadelphia has given women these rights, And we think that women across the Commonwealth of Pennsylvania should also have the right to express milk in the workplace, so that it's not dependent on where you're working or the type of job you have, whether you're a salaried employee or whether you get overtime or not under the Fair Labor Standards Act. We think that if you work anywhere in Pennsylvania, the law should protect you when you want to express milk in the workplace, so that your employer can't force you to make a choice between, you're giving your child breast milk and keeping your job, which is a choice that, as Dr. Krajewski said, lots of women are forced to make because if they are prohibited from expressing breast milk in the workplace, which might happen if an employer refuses to give somebody the break time they need to express breast milk, then her milk supply will be reducing very quickly, and she won't be able to express milk. And she also might experience pain because she's not able to express milk. So what we need to do is pass legislation across the state. And in Pennsylvania, we now have a bill pending in the Pennsylvania General Assembly known as the Pennsylvania Workplace Accommodations Act. Workplace Accommodations Act. It's House Bill 1100, and its prime sponsors are Representative Mary Jo Daley from Montgomery County and Representative David Parker from Monroe County. It's a piece of bipartisan legislation that was introduced in May of 2015, and we had a public hearing about it in the House Labor and Industry Committee last October. If it passes, the Pennsylvania Workplace Accommodations for Nursing Mothers Act will provide all employees in Pennsylvania with break time and a private clean place to pump that isn't a bathroom, as long as doing so does not impose an undue hardship on employers with fewer than 50 employees. It also provides all working women in Pennsylvania with the right to file an administrative complaint or the right to file directly in court to get immediate relief, which is incredibly important when all a woman wants to do is be able to feed her child breast milk, and her employer's refusal to allow her to pump causes a reduction in her milk supply because time is of the essence in these cases. The bill, if passed into law, would also prohibit retaliation against women for expressing milk or for filing a complaint, and there is no one-year limit. So for those women who would otherwise be protected by the Affordable Care Act because they would maybe get overtime by under the Fair Labor Standards Act, those women, though, who are now, the child is now 13 months or 14 months and would not be protected under the Affordable Care Act anymore, if this law becomes state law, would then have protections under the state law. Many other states have done more to protect women who want to express milk in the workplace. Some of those states include New Mexico, Oregon, Colorado. The list goes on and on. Utah did it recently, and we believe Pennsylvania should be next.
Okay, thank you, Amal. Now we're going to talk to our friends from Maternity Care Coalition again. We're going to tell us about their experience on the ground. We're going to talk about the business case for having these accommodations, as well as give us insight from their experience working with companies who want to make this happen and discover, happily enough, that it isn't all that complicated and doesn't need to be.
Thanks, Tara. So throughout the years, Maternity Care Coalition created many multi-layered breastfeeding-friendly programs that is aiming to change the breastfeeding landscape in Philadelphia region. Among the many things we do is that we work on changing policies and systems, and our work with employers is a great example for that, which can be a model in Pennsylvania. MCC realized that there is a need to educate employers and the business community about the business case for breastfeeding and why it is a win-win situation when employers support breastfeeding employees. As listed here on the slide, case studies have shown a high return on investment for employers, and they get a $3 return for every dollar they invest in an employee lactation program. And it improves employee retention through employees at companies with nursing mothers accommodation work longer during pregnancy and return to work sooner and feel more loyal to their employers. Employers with loyal employees can reduce or eliminate the high cost of hiring and training the new employee, which is estimated to cost about 1/5 of the current employee's salary. A study of several companies with lactation support programs revealed that 94% retention rate for new moms versus a 59% national average for new mom retention rate. It also improves employee morale. Employees at companies with nursing mothers accommodations have higher morale and productivity. Of course, it is also a great recruiting tool, and allowing mothers to express breast milk in the workplace helps you to attract top talent and improves your image in the community. It also lowers absenteeism, and moms and dads will miss less work to stay home and for sick babies because the breastfed babies are healthier than formula-fed babies. Even when breastfed babies do get sick, their illness do not last as long as illnesses in formula-fed babies. So absences to take care of a sick baby are unpredictable and cannot be scheduled in advance. Breaks to express breast milk throughout the workday are predictable and can be scheduled in advance. Lower healthcare costs for breastfed babies have lower rates of common childhood illnesses and stronger immune response to vaccinations. So all of these health benefits result in a decrease filling of health insurance claims throughout an employee's work life. And now I'm going to take it over to Katja.
So I can't see the PowerPoint. So Dave, maybe you can go to the next one, slide number 13. So since the past 6 years, MCC has been working with employers by offering technical assistance to help create and strengthen workplace breastfeeding support. And so
I'm just going to jump in and interrupt real quickly. Can you show the screen on your end?
No, I just see.
Can you accept
there is something that I clicked at before and then everything went.
Can you click it again? Here, so that you can control it. There you go. Okay, I see your screen. You need to put up the PowerPoint presentation. Do you have the slideshow in front of you?
It's gone.
It's gone.
Can we still?
Can you maybe show the slide? Take over and show the slide.
Yep. Yep. Amal, can you do it? You have it in front of you?
Yep.
All right.
Yes, we have it up.
Okay.
Okay.
Do you accept
Great.
control?
Yep, we are right now.
There you go. Perfect.
There it is.
Let me know. Go into.
Thank you.
Does that look okay? Okay.
So, as I said, from my overall experience working with employers, you know, when you start to work with employers and to discuss workplace breastfeeding support, they are not resistant to supporting nursing moms. It's more about that they're seeking for clear guidelines and some guidance. And so during the conversation then, they realized that the needs, to meet the needs of a nursing mother is really easy to do. So, and again, as you already heard during this presentation, it is a sanitary private place to express breast milk, so it doesn't have to be a designated room. It can be private space. And this could be any empty space that is available, any empty office. It could also be a multi-purpose room. So a room that is already used, let's say, for office supplies or for mailing, and you could convert a space for that. It could be using conference rooms when they're not scheduled for meetings. So there's many ways you could create that private space. And then obviously the break time. And so normally when I talk to an employer and with human resources, we look at the already available break time that the employee uses, and employers are very open to that they can use those times. And then sometimes, because if, for example, I'm currently working with an employer, they have 2 10-minute breaks, and obviously 10 minutes is not enough to leave the workstation, go to the pumping room, set up the equipment, pump, and then clean the pump again, and then store milk and equipment, and then go back to the workstation. However, normally the employer is very open to extend that time because they just know what the benefits really are, as Rose priorly pointed out, that those employees are very appreciative and are very motivated when their needs are met, not only as an employee but also as a mom. And as Amal pointed out, the ACA excludes currently some groups of workers, and this actually causes some confusion for employers because employers have often different categories of employees, and so it is really difficult for them to kind of come up with an accommodation which is only applicable for a subgroup of employees. So for them, having a more inclusive law, which Philadelphia has, would actually be very helpful for them because then they don't have to figure out how to now offer those accommodations only to hourly paid employees. And another thing that I also learned is the importance of a written breastfeeding policy. And normally employers would go ahead and actually come up with a written policy if there is a law asking them to do something, and that would give them the framework to create a written policy and to make sure that they are compliant with all the requirements. And at the same token, with a written policy, you also can make sure that every employee, first of all, knows about those accommodations and has access to those accommodations. Because normally what I learn, if there is no written policy, then it's basically more a case of luck if you receive that accommodation because your supervisor is accommodating and knows about the needs, or you know, you don't have luck because nobody knows about this and don't offer you those accommodations, don't inform you about that. So that's why we need a written policy, and with that, obviously as a base, we need a written law. So that was my part. I pass on to Amal, I think.
Okay, thank you. This is Tara again. So thank you for that. And what I want to explain next is where this effort falls into the larger Pennsylvania agenda for women's health. The Pennsylvania Agenda for Women's Health is a proactive, pro-choice legislative package of bills. There's 13 bills in all currently packaged into the agenda. These bills are all sponsored and supported by the Women's Health Caucus of the Pennsylvania Legislature, which is a bipartisan, pro-choice group of lawmakers committed to calling and providing for evidence-based policy solutions to real problems faced by Pennsylvania women and families. And we certainly know that this is a real problem faced by Pennsylvania families. In fact, Maternity Care Coalition just hosted an event in the last couple of weeks that we got to hear women come and talk about not only how important breastfeeding was or is for them, but also the challenges that they've experienced continuing to breastfeed because of challenges of pumping milk in the workplace. The Pennsylvania agenda currently, as I just mentioned, has 13 bills in all, and some of the efforts associated with those bills is to clarify workplace protections for pregnant employees, just like we're trying to clarify the workplace protections needed for nursing employees, to fix Pennsylvania's broken equal pay law, to extend sexual harassment law to cover all employees in Pennsylvania. Currently, it doesn't cover employees of very small companies in Pennsylvania, to increase the minimum and sub-minimum, which is also called the tipped wage. As many of you may know, Pennsylvania currently has the lowest minimum wage allowed by federal law at $7.25 an hour. To address harassment outside of healthcare facilities, specifically we see that at healthcare facilities that provide abortion care. That is also has risen significantly in the last year. There is a bill to protect patients from turning lies into laws. That's called the Patient Trust Act, and Pennsylvania actually has an opportunity to be a model state about this law. Physicians in particular are from all over the country are watching Pennsylvania for what we do because it's the first real effort that will prevent
legislators from passing laws that force doctors to either lie to patients or gag them from sharing certain information. There's an effort to remove financial obstacles from for domestic violence survivors who are trying to leave abuse. There's a bill to call for attention, specifically calling for a task force to be assembled to assess the unique needs of female veterans. We have a rising number of female veterans returning to Pennsylvania. And to ensure fair pensions for widows of state and municipal employees. So the agenda, the Pennsylvania Agenda for Women's Health, is the package of bills. That's the legislative roadmap for improving, very concrete, specific steps that we can take to improve women's health and economic security in Pennsylvania. The Pennsylvania Campaign for Women's Health is the collaboration of local, state, and national organizations who are all working together to advocate for these solutions. And we do that by advocating for the policies, as well as trying to educate as many constituents as possible to let them know about these solutions and ask them to raise their voice. So we're building power on the ground in Pennsylvania to call for these proactive solutions to very specific problems. Currently, we say it has more than 50 local, state, and national orgs on this slide. I can tell you that it was 53 2 days ago, and now it's 54. We're just welcoming the Philadelphia Black Women's Health Alliance to the Pennsylvania campaign. And it's a host of different types of organizations, and the goal is to share information, to build capacity, and to all work together toward these common goals that we have. Our priorities, as you can see from some of the examples in the agenda, are informed by our shared understanding that you cannot separate women's health and economic security. You cannot work on one without the other. They need to happen together because they inform one another. And above all, we are advocating for evidence-based policies in Pennsylvania. It doesn't sound particularly radical, but it can be considered radical considering some of the non-evidence-based policies that we see proposed here in Pennsylvania that would disproportionately affect women. Do want to let you know that the campaign is building on success. It launched just a couple of years ago and has, over 54 organizations now, starting from zero, of course. And some of those successes are 3 bills that have already been passed into law that we advocated for together. One of them protects domestic violence survivors from unfair eviction. You may have heard about this situation. It was in the news. It was all over the national news when it was discovered that in some municipalities in Pennsylvania, landlords were able to leverage nuisance ordinances to evict domestic violence survivors for calling 911 or police subjectively too often. So that bill got passed. The other one is an intimate partner harassment ban. That's sometimes colloquially referred to as revenge porn. And then a cliff effect study. Part of the success beyond just getting bills passed is, of course, raising constituents' awareness of problems that are happening and informing people of their rights. And so we also consider getting some public hearings on some of these issues a big success as well. Within the past couple of years, we had a hearing on the Patient Trust Act. We had multiple hearings on the Equal Pay Act. In fact, I believe that was the first public hearing on the Equal Pay Act in decades, at least 4 decades. We did also had hearings on the bill that we're talking about today, the Pennsylvania Workplace Accommodations for Nursing Mothers Act, as well as the Pennsylvania Pregnant Workers Fairness Act. And that's very important because it gets testimony from constituents and data onto the record. So we've talked about what we need specifically regarding nursing mothers in Pennsylvania, but in the big picture, the reason we need the campaign and we need to advocate for these common sense policy solutions is because, frankly, Pennsylvania is failing women and girls in many respects. Women's economic status is ranked at the last annual survey, given a D+. Women's health scored a C, and women's political leadership and representation scored a D as well. And this was not the last year's survey results was not an outlier. Pennsylvania consistently is scoring low across key factors of women's health and economic security annually. A recent state-by-state analysis specifically of policies that support parents and working parents, Pennsylvania earned a D-. And of course, what we're talking about today is supporting working parents. So what can you do if you are already a member of the Pennsylvania Campaign for Women's Health? We thank you. If you are not, please consider your organization joining our efforts. We would love to have you. As an individual, you can sign up to get email updates and action alerts. We understand everyone has busy lives and, you know, multiple issue lives and things going on, so we try to make it as simple and straightforward as possible to inform you what you need to know, when you need to know it, in a very straightforward manner, and when it can really count, and sending an email or picking up the phone will make a difference to your representative. We send you that action alert and ask you to take action at that time. You can also follow along on our progress as well as news associated with these issues that we're working on by liking the Pennsylvania Campaign for Women's Health on Facebook. And you could, of course, independently of us, go ahead and you are welcome at any time to call and write your lawmakers asking them to support the Workplace Accommodations for Nursing Mothers Act. Okay, and now I'd like to open up the line for any questions that you may have for any of our hosts today.
And anyone with audio capabilities can raise their hand by clicking on the hand icon on the control panel, the GoToWebinar control panel, or you can type questions in the question bar, and we'll take those questions as they come up.
Anyone have any questions for any of our hosts today, or just in general about either this particular issue or the campaign at large? Okay, it sounds like we were super clear. We covered everything.
Well, actually, we have a question that just came in.
Oh, great.
That asks, what's the timeline on this, the bill that's the main focus of this presentation?
Okay, this is Amal from the Women's Law Project. I guess I'll start answering that, and Rosemary or others, if you'd like to jump in, feel free. So as I mentioned in my portion of the webinar, the bill was introduced in May of 2015. We did have public hearings in October of 2015, and it has pretty much stalled since that time. Pennsylvania has 2-year legislative sessions, which means that at the end of this year, if it doesn't get passed into law, it would have to be reintroduced next year. And we are hoping that we can apply pressure on lawmakers and really encourage them to pass this piece of legislation because it is so important for women in Pennsylvania. And, you know, it's something that we really do need to write our lawmakers about and get passed. So the timeline is a short one for this version of the bill, and it is possible that if we're not able to get it passed into law this fall, and the legislature comes back into session mid to late September, then it would have to be introduced come January. Rosemary, do you have anything to add, or anyone else?
Yeah, and I would just add them all, like, again, as you mentioned, the legislative session is very short. There's only 10 scheduled days right now for this legislative session before the general election. So it's really imperative that we get these bills out of committee and to the floor for a vote. So to the extent that anybody on the call can advocate for that, we'd be really grateful.
We have another question that is asking who are opposed, what groups are opposed, individuals opposed to this legislation, and what are the arguments for opposition?
This is Amal again. I think I'll start answering that, and others can feel free to jump in. Well, at the public hearing, it seems like the people who are opposed are generally in the business community. The Chamber of Commerce represents their interests, and their concerns are that, well, one, they think that a lot of employers are already providing these accommodations, and so a law is not necessary from their perspective. even though we know that there are people who are denied the ability to express milk or forced, if they want to do it, forced to do it while sitting on a toilet seat or in a janitor's closet where there might not be an electrical outlet for their pumps or they're in the dark. So we know that that's not true across the board. And those are the arguments they generally make, is that the law really isn't necessary. And then they argue that it will increase litigation, which, you know, this is a law that has passed in a number of other states, and it really has not been shown to increase litigation, because really what it does is it clarifies the law for the business community. As Katya said earlier, you know, it is one of these things where there is this patchwork of protections currently. It doesn't apply to all workers. And what this does is it clarifies that if you are an employer in Pennsylvania, you have to provide these accommodations. And generally speaking, when they do it, our experience has been with the women that we have helped has been that it isn't very hard for employers to do it, and that, you know, it becomes something that becomes very simple. So the arguments are not, in my opinion, not very strong. The arguments against it, yeah.
And I just want to add, Amal, that you know, the business case for breastfeeding, which is the HRSA kit that can be available to businesses, really walks them through this process that, you know, helps them see that the accommodation can be very reasonable with communication with their employee, and that we estimate that over 1,000 women in Pennsylvania would be impacted by the passage of this bill if it happened this year.
We have another someone who's live here, so let me unmute her. Leilani, I hope I got your name right. Are you on? Leilani? Are you there? She also typed in her question. A question is, how many hospitals in Philadelphia have written breastfeeding support for employees policies in place?
So this is Katya. So I'm actually working with the Philadelphia Birthing Hospitals, but more so on implementing policy and practice changes for the patients to initiate breastfeeding. But I know that most of our Philadelphia hospitals have a written policy and are supporting their nursing employees. And now, because of our 6 Philadelphia birthing hospitals, 5 will become baby friendly. So that's a national designation, and part of that also is that the hospital then also provides workplace breastfeeding support to their employees.
Great. We have another question that's come through. It asks, which states have laws that can be viewed as models for Pennsylvania to look at as it relates to this issue and others?
This is Amal. I mean, I do think House Bill 1100 is a good bill as it is currently. And so I think the bills that would be good models are ones that are similar to that. And that bill has sort of similar language to what the Affordable Care Act did. It just is broader than the Affordable Care Act and applies to more employees. And so I think the Affordable Care Act is a good model, because that is something that I think has caused a lot of states that have done this since 2010, they sort of use similar language. Prior to 2010, the states that had good language would be, I would say, Colorado and New Mexico, for example. And the states that passed these types of bills prior to 2010 are all a little different in sort of how they talk about what is required. But generally speaking, all require a clean private space that is not a bathroom and the break time.
And we have another question. Are there any other things that are planned at this point to increase awareness on this issue? And I think related to that is, how can people help?
Well, this is Amal again. Well, August is National Breastfeeding Month, and there have been events this month, including this, to talk about this issue. And our organizations do have information on our website about the rights people have related to breastfeeding, both in public, such as the public breastfeeding law we have, Freedom to Breastfeed Act, and also in the workplace and the need for better protections in the workplace. So we do have some information online, but I do think we have to continue to talk about it. We need to write to our legislators, and we have to really apply pressure to get this bill out of committee and onto the floor, as Rosemary said earlier.
This is Tara. We can't emphasize enough how important it is to contact our lawmakers and ask that they support this bill, ask if they're co-sponsoring it, ask if they're doing anything to push it along. You know, we have moved the needle by having those public hearings and getting all the good common sense evidence on the record of why we need this in Pennsylvania, and even addressing how incoherent Pennsylvania is on the issue when you can go to the Pennsylvania Department of Health's website and see a recommendation to breastfeed for up to a year, and then have women working in Pennsylvania unable to obtain the necessary accommodation in order to do that. And frankly, in order of the order of effort aligns with the order of importance from what we hear from lawmakers, that a visit is very impactful, a phone call is impactful, and then an email below that, which kind of makes sense in terms of, just a little bit more effort into it. The in-person meetings with your representative is invaluable, but barring that, we would recommend, an email is great too, but a phone call, checking in. And if they're already supporting it, then that's great, and they get the opportunity to tell their constituents that they're already looking out for them.
Right, and if you go onto the Pennsylvania General Assembly's website and you look at the bill, you can see who is a co-sponsor of the bill. And so, as I mentioned earlier, the prime sponsors are Representative Daley from Montgomery County and Representative Parker from Monroe County. And you can look and see if maybe your legislator is already supporting it, and then maybe if you would want to contact them and let them know that you think this is important and that it should be pushed, that could be helpful as well.
I just wanted to add, this is an election year, obviously, and we have to make the voices be heard of women, and that women's lives matter, and that this is a human rights issue, so that getting other women on board and making sure that they support each other on this is critical. So working with other organizations that are part of the PA campaign are critical, as well as to emphasize how important this bill is.
We have probably, if it's more into a question but aligns to the purpose and focus of the legislation, asking to share the law in Minnesota that requires nursing accommodations. It had a state investigation mandate. Is a part of that includes notice to employers within 48 hours, I imagine, of a complaint, and completed investigations within 10 days. So this may be asked, let me get the question from the enforcement side of things. What does this legislation do to ensure enforcement of granting these accommodations?
Sure, I'll take that. That's Amal. So the bill as it is currently, House Bill 1100, you can file a complaint with the Department of Labor and Industry, and there are, my understanding is there will be some amendments that the Department of Labor and Industry has looked at that would give a little more information on how an investigation would take place. But that's one avenue, but the other avenue is that a woman can file a complaint in court and get preliminary injunctive relief, which would give her an immediate response from the court, because this is an issue where time is of the essence, and so enforcement could be done that way as well, which is a mechanism that is not available under the Affordable Care Act.
I believe that concludes the questions that have been posed. So I'll hand it back over to all of you guys.
Okay, great. So wrap up just a tiny bit early then, and if there are no more questions, I just want to thank everyone once again for participating and tuning into this conversation. and being willing to advocate for working women in Pennsylvania. And if you think of a question later or a concern, or you want to reach out and just explore how you could advocate for this or become part of the campaign, please feel free to contact the Women's Law Project at any time. And let's see, some contact information. And if you want to take a little bit more time to go through the legislative roadmap, the agenda for women's health in Pennsylvania, you can go, I have that website up on the screen now, paforwomenshealth.org. And you can also, like you said before, like us on Facebook and sign up for updates. And I want to thank all of our participants today. And once again, thank you, Dave, from the Public Leadership Institute for coordinating our technology today.
You're very welcome, very informative.
All right. Okay. Thank you, everyone. Have a good afternoon.